name is Greg Kolovich. I'm an orthopedic surgeon in Savannah, Georgia. I work at Optum Orthopedics. I did my residency at Ohio State. I did my hand and micro training at Harvard, Mass General. You know, when you look at key performance standards, you have to look at the success rate. You want to do something that is certainly above 90%. You don't want to do things that are a coin flip, 50-50. That's not a good treatment. So when you look at PT therapy, in my experience, it's really sort of 50%, maybe 50 to 75%, not north of 90%, where most surgical results are. So you want to get it as successful as possible. But then you also have to look at, well, how long is this going to take and how expensive is it going to be? Because if this is going to take 6 months to get better, that's a lot of time for people to take off of work and to rehab from. So you want to marry the rate at which you can return to activity, we would call your recovery time, with the success of the procedure. And, while surgery is extremely successful, in my opinion, it can take 3, sometimes even up to 6 months to get back to where you want to be. So we're always looking for treatments to shorten that recovery time. And I think doing an Ocelot TendoNova procedure with PRP injection, I think you're going to find that the recovery is much faster. The expense certainly is going to be far cheaper than doing open debridement with anchor fixation. So you marry a lot of key performance measures that I value, and that is, a faster return, less pain, and of course, everybody's happy when you can make it cheaper, because I think people are going to, it really shortens the burden, or it really lessens the burden for the third-party payers that are having to pay for these procedures, or even out of pocket for our patients. So you want something that's fast, effective, minimally invasive, less pain, and of course, less expensive for everybody. So if you look at things that the Ocelot can treat, a lot of tendinopathies, lateral epicondylitis or tennis elbow, medial epicondylitis or golfer's elbow, Achilles tendonitis, you can use it for plantar fasciitis, patellar tendonitis. I mean, a lot of the tendinopathies is typically what I use it for. I think there's some potential in the shoulder as well to treat these tendinopathies. The nice thing about it is it's all percutaneous. There's no incision. Anytime you make an incision, you have to dissect down. It's more dissection, more swelling, more post-operative pain or post-surgical pain. So you're mitigating all of that by using a percutaneous needle. You have the ultrasound to help you through your landmark, so you can get the needle exactly where you want. So I think those are all advantages of the Ocelot. But yes, I mean, for me, when I sell it to patients, their first question is, does it work? We know that the success rate is north of 90%. In my experience, it's been around 92 to 95% successful. We know the recovery is quick. Most patients are getting good results within 6 weeks. I really don't see patients that are having the pain-free exam from surgery until somewhere between 6 and 12 weeks. Here I'm getting it somewhere between 4 and 6 weeks, so there's definitely a shortened time, and that makes sense. You're not getting less. You're not getting the swelling. You're not getting that 2 weeks of postoperative pain. There's no stitches involved or anything, and you can get them moving right away, which really helps with their range of motion, so they don't get stiff or anything like that. So I think we always need to be striving to do techniques that work, that are more minimally invasive, more cost-effective, and this accomplishes all of that. The next patient I had much more confidence in. This was a primary person, huge golfer. I work and live in Savannah. It's a huge golfing town. People don't want to take more than the day off from golf. It's a big driving force for these patients to get back on the golf course. So he came into me and said, I don't want surgery. I have this problem. I've tried everything. And he had numerous injections as well from another surgeon. So I offered him that, and he also demonstrated success within 4 to 6 weeks. So he was another patient who I thought originally would do better than a workers' comp, but they both, the one thing that pointed out to me was that their success and their pain-free clinical exam was somewhere between 4 and 6 weeks. It wasn't that classic 8 to 12 weeks that we see with surgery.